After weeks of closure due to the COVID-19 pandemic, this morning the Sabarimala temple in Kerala opened its doors to devotees. The temple will remain open from today till the 21st of July. That's for the next 5 days. And 5,000 devotees are going to be allowed in daily through an online booking system. Now, according to authorities, COVID-19 protocols, including the wearing of masks, of social distancing, all of that will be strictly followed. Whoever wishes to visit the temple will have to provide a complete vaccination certificate or a negative RT-PCR certificate or a report that has shown that you took the test 48 hours of your visit. Remember, Kerala is currently the state worst affected by COVID in India. The largest number of fresh COVID cases reported daily are from Kerala. Now, the Sabarimala temple opened its doors to the public a day after the Supreme Court made it clear that right to life matters above everything else. This in the midst of a COVID-19 pandemic, and it's given the UP government until Monday to reconsider its decision to allow the Kanwar Yatra to go ahead this year. Tonight on Left, Right and Centre, we're asking what takes priority, religious sentiments or our right to health, our right to life? Can we as Indians not give up religious festivities in the larger interest of our health, given the fact that we are in the midst of a COVID-19 pandemic? We have Geeta Bhatt joining us on our show tonight. We have Geeta Bhatt with pro-BJP leanings. We will have Dr. Anita Ramesh joining us. Anita Ramesh Chandra, Senior Medical Oncologist from Apollo Hospitals, the specialty hospitals in Chennai, a professor and HOD. We'll also have Ghanshyam Tiwari also joining us and hopefully getting more guests. He's a spokesperson with the SP and hopefully also getting Rahul Ishwaran, social activist, joining us from Kerala. All right, Geeta Bhatt, I want to start with you because you have two BJP states and you have two completely different reactions. You have Uttarakhand, which has been burned by the experience of hosting the Kumbh Mela, then paying the price during the second wave. And then on the other hand, you have UP, not willing to learn from Uttarakhand's experience. The UP government keen to go ahead with the Kanwar Yatra despite fears that it could be a super spreader event, despite warnings from public health officials. And no clear message from the centre. Is the BJP playing good cop, bad cop here on this matter, and in the process really playing with the lives of not just UPites but residents of all states that the Kanwariyas will pass through?
Well, you see, definitely it is very important. There is an echo. If you can please get it corrected. So, you see, definitely in these COVID circumstances, it is very important that, the COVID protocol has to be followed and needs to be followed by all the states, including Uttar Pradesh, Uttarakhand, or whether it is Kerala. But keeping, the sentiments of people in mind, there are times when, in the society, it is expected that there will be when it comes to our rituals or some kind of at least there is some kind of a symbolic celebration of events, and most of the governments, they are doing it. Even in Kerala, you just mentioned about Sabarimala temple, which is going to be open for a certain number of devotees per day.
5,000. Similarly,
right. So at the same time, Kerala government has done a series of COVID relaxations with the upcoming Eid celebrations on 21st. From 18th onwards, they have relaxed, given relaxation in the COVID lockdown and also allowing all the shops to be open in the market across Kerala up to 8 p.m. So they are, so the governments are trying to, accommodate the festivities which are related, to each of the community.
But is it the government's job to accommodate people wanting to attend festivities, or is it the government's job to make a priority one's right to health, one's right to life? And ironically, both states, UP and Uttarakhand, are going to the polls. But as you point out, yes, we are entering festive season. We have Eid coming up, Ganesh Chaturthi in Maharashtra. In a sense, our government's reactions to the Kanwar Yatra, to the Sabarimala temple reopening, that's really going to set an example in this festival season. Rahul Ishwaran joins us now from the Dharma Sena Secretary from Kerala. Rahul, you are in Kerala. Kerala is currently leading with 13,750 cases. It leads the states in the most number of COVID cases in a day in India. The second wave hasn't even abated in Kerala. And yes, you have the temple trust, and yes, of course, they face huge financial losses when the temple stays closed. But we've all faced financial losses this year. Isn't life more valuable?
Sir, please remember, last time when the communist government even allowed the temples, Sabarimala took the lead in saying that thanks to the government, but we don't want to open the temples.
Was that because cases, they had reported cases? Wasn't that because priests themselves were getting COVID?
No, it was because of the care and concern for the devotees. And yes, there were cases around. See, let us see the positive aspect. Even when the government said you can open the temple, amidst, even if you accept for the sake of argument the cases, the Sabarimala temple took initiative in telling that we don't want to open the temple.
Similarly, so what's different now, Rahul? It should be, the concern should be more now, given that Kerala is the only state where everybody else is facing a falling rate of cases, fresh cases. Kerala has 13,000 cases.
But Saraji, please understand, we are living in a new normal. We are living in new realities. When every other sector is being opened up in a very systematic manner, can be single out spiritual gatherings, can be single out spiritual and religious places. And spirituality is also an important part of solace to our public. Whether it is any yatra, I believe every religious sect, maybe Hindu, Christian or Muslim, will be ready to listen to public health experts and government. But please don't take a line that it should be closed when everything else is being opened up. Is it right to single out spiritual gatherings and say no? That's the reason why there can be symbolic yatras, symbolic opening up. Sabarimala usually welcomes around 5 lakh people per day in the top seasons. But right now it has been reduced to 5,000 with all the necessary precautions. So let us be realistic. Let us
What do you mean by necessary precautions? Because Uttarakhand went ahead with the Kumbh Mela despite warning some experts. We saw a sharp increase in COVID-19 infections. There was a fake COVID test racket exposed, that the tests produced at borders before entering the Kumbh were fake. Rahul Ishwaran, I mean, we live in India. There's always jugaad. We know the great Indian jugaad. And what about, what about police personnel who have been deployed in Sabarimala right now to monitor devotees, to ensure strict adherence to COVID-19 guidelines? Who will answer to their families if they catch COVID?
I mean, they also have, everyone has a responsibility. It is a collective responsibility. That's the reason why the number has been drastically reduced to 1%, and all the necessary precautions are there. I believe we should learn to live in a new normal. This situation may be, for months and years altogether. We cannot shut off the entire spiritual arena from the devotee's mind and say that every other segment can be open. For example, in Kerala, alcohol and beverages shops are open, and right now temples are not being open. Is it fair? Then there are longer queues.
So the point you're making is that faith is also a part of healing, of mental, reducing mental stress, etc. Ghanshyam Tiwari, your response, what would you say? Rahul Ishwaran says, how can you shut down religious festivities when everything else is open?
Well, from Rahul Ishwaran's standpoint, good evening to every one of the viewers as well as the co-panelists and you, Sarah. From Rahul Ishwaran's standpoint, it is a logical and plain argument to make. But when you are a decision maker, when there is a government, there is one decision maker. But in BJP, we see that there is a Uttarakhand CM as a decision maker, then there is Adityanath as a decision maker, then the BJP central government. It is almost like a ploy to confuse people. And then comes the Supreme Court. And on one end, if these organizations, which actually elected by the people for public welfare, are deciding how to conduct Kama Yatra rather than how to improve the healthcare facilities, how to take
with the mind, with an eye on the elections coming up.
There is only one mind that the government has. The government is not a multifaceted, talented government, as you can see from the cabinet expansion. This government has a single track mind where it wants to focus on only one thing: how to keep its pot of competitive religious politics boiling all the time. And as a result, logical arguments such as what Rahul is making will not hold. You have to understand what the government is doing along with what BJP as a party is doing. The competitive politics in the time frame of pandemic has seen what they did with Tablighi Jamaat. It has seen what they did with Kumbh. Their competitive politics beyond religious politics showed what they did in Bengal, and then they do not even acknowledge the deaths in Uttar Pradesh. I think it is a shame that this kind of decision making is followed, where people are at the end left with zero accountability.
And meanwhile, in the midst of all this, we have a third wave that is imminent, says the Indian Medical Association. That's the country's top doctors' body. The doctor's body says tourism and pilgrimage can wait. Remember, India reported 38,000 new cases in the last 24 hours. Yes, marginally lower than yesterday, but the deaths reported in a day, 560. The R factor right now is at 0.95. It was 0.75 just 4 weeks ago. And vaccinations way below target. We are vaccinating only an average of 34 lakh a day. We need to do over 80 lakh a day. So in the midst of this, Dr. Anita Chandra, what would you say in response? Geeta Bhatt says precautions are put in place. Do you think it is possible, or do you think we can condone the opening up of religious events, rituals, festivities where you have 5,000 people gathering in a day, millions like the Kavar Yatra? Because as far as I know, and correct me if I'm wrong, doctor, we have to do social distancing, whether you're going to a gym, whether you're going to school, whether you're going to office, or whether you're going to a religious ritual, festival, a church, a mandir, a mosque.
Yes, what you said is correct. Yes, see, the religion can wait. Pilgrimage can wait at this point of time. Remember, Sarah, I also want to tell the viewers, being a medical profession, we are just being pushed to the brink. Yes, now the second wave has not yet been over and the third wave is starting. So, you know, yesterday WHO declared that we are already in the early stage of the third wave because Indonesia, other countries, the cases are rising. Today, ICMR declared the third stage is rising, and we do not know what the virus will do. The virus is undergoing mutation. Some mutations are good, some mutations are bad. And you have rightly pointed out the R factor. What you said is less than 1, but there are states in India which is more than 1. Yes. Arunachal Pradesh, Assam, north part of India, northeastern India, and our Prime Minister already addressed them because that's the fear in the hill station with crowding. The R factor means infectivity rate. Yes. How many people can you infect with this? So R factor is rising. This is all as per the mathematical model. It gives you a thing. Yes, we are getting into the third phase. Yes, I understand. I respect the viewers of all my other colleagues. Finance, livelihood has to run parallel with the third wave and the virus. But that doesn't mean you will open up religious festival functions. What we saw in UP, Kerala and the other states, it's not acceptable. We should not do anything like that.
Dr. Vamanacharya, Dr. Vamanacharya, we just emerged battered from the second wave. Please hear this, doctor. Do we not remember the sounds of the ambulance sirens at night during those frightening 2 weeks at the height of the second wave? We seem to have selective memory. The Prime Minister says, you know, bang thalis for the doctors and healthcare workers, but spare a thought for them now. Doctors, nurses, they don't have a choice. They have to treat everyone, whatever their religion, whether you've been careful and mindful, or whether you've been blasé, taking holidays, attending religious festivals. Vamanacharya.
Yes. Yeah, I have heard what has been going on, but when all the activities have been opened up, see, malls have been opened up
by the government, sir, by your government.
My own government has allowed in many places so that things will come to normal, because this so-called third wave or mutated virus, their infection, all this will continue to be there in this country for next at least 1.5 years. Country cannot be closed for such a long.
So I beg your pardon, but the Prime Minister yesterday said we have to prevent the third wave.
You can also see that pilgrimage and tourism is also a part of the industry and question of livelihood to millions of people in this country. So I agree to your point that
this goes back to my question about good cop and bad cop. The Prime Minister said yesterday that we need to prevent a third wave. That was the orders that he had given.
Yeah, that,
but you're saying that the third wave is going to be a part of our lives. This is going to continue for the next few years.
Is not the point. See, banning religious activities is not the only plan. If you want to close, you have to close everything. When we have accepted that, we'll slowly come back to normal. Religion, religious activity, pilgrimage also should come to normal. Yes, I agree with you that we should follow some norms like social distancing and mask, and more importantly, vaccination. Once vaccination happens, by and large, 95% of resistance will be there and people can be protected. But you cannot wait. Even in countries like America and Europe, vaccination has been slow. There has been delay, and it will take another 2 or 3 months to complete the whole vaccination program in this country. Country cannot wait to normalize till this long. We have started both. I am sure that the total resistance in this country acquired either by vaccination or by mild infections has reached such a good number. Because of that, the second wave, after that, the infection rate is less than 2%, 3%. In some of the cases, it is even less than 1%. Because people have already acquired some resistance. It is natural for a large country like ours to slowly limp towards normalcy. This is the approach.
I'm not sure what we want our new normal to be. Schools aren't opened. Our children aren't allowed to get an education. Is that the new normal? But I want to go back to Dr. Anita. Doctor, what would you say to Dr. Vaman Acharya, who says that, you know, this third wave may or may not come, there's resistance, people are resistant, and to the authorities who say, look, we're taking precautions, that everybody attending the Sabarimala temple will have an RT-PCR test, for example, or they're double vaxxed?
Yes, Sarah, first thing for double vaccination, even I am double vaccinated. Double vaccination does not give you 100% protection from the virus. It just gives you 60, 70, some cases 80. Till 20% of the time with the double vaccine, you are exposed to get the COVID virus. It may be mild, yes, but you can get infected. So it doesn't rule out. Again, RT-PCR 48 to 72 hours only tells you at that point of time you don't have the virus, but you can get infected after the darshan or while coming back home. So there's high chance of spread with these two clauses in place. Yes, third wave can happen. Now, let's come to vaccination. Then only, I think, 39 crore, or approximately 40 crore is vaccinated, rest is not vaccinated. I request, until and unless the entire country is vaccinated, don't open tourism and don't open pilgrimage. Yes, we'll open, yes, a little later. And again, until and unless herd immunity gets into the place, then only you should open the country. Otherwise, you saw the pictures
while our
which has
vaccination
happened.
rates are falling, to open up more and to allow rituals like this, 5,000 people gathering in a day. I agree for once with Rahul Ishwaran that you need to change with the times. I think that extraordinary times call for extraordinary responses. COVID is the new normal. We have to adjust and adopt. And I want to close today's debate, today's show, by repeating what the Supreme Court observed on Friday. They said that the Uttar Pradesh government cannot go ahead with the Kavar Yatra in the interests of the health of the citizenry of India. The health of the citizenry of India and their right to life is paramount, said the Supreme Court. All other sentiments, albeit religious, are subservient to this most basic fundamental right, the right to life and the right to health. On that note, thank you all for joining us tonight. Stay safe.